Hi, welcome to the introduction of occupational medicine. At the end of this lecture, you should understand the basic principle of occupational medicine practice and know how to take a proper occupational history. Occupational medicine is a clinical specialty concerned with the diagnosis, management, and prevention of diseases due to or exacerbated by workplace factors. It is a clinical discipline, focusing on preventive medicine, and aiming to prevent diseases and promote wellness among workers. Occupational medicine plays an important role in advising the employers on the proper management of illness, injury, and disability related to the workplace. Occupational medicine practice ensures that the highest standards of health and safety at work can be achieved and maintained. Occupational medicine covers the following areas: occupational hazards, diseases, toxicology, fitness for work evaluation, disability assessment and rehabilitation, workplace intervention, research methodology, occupational health laws and ethics, health promotion, environmental medicine, and management skills. The detailed knowledge on occupational hazards, toxicology and diseases is part and parcel of occupational medicine practice. Occupational medicine covers both occupational diseases and work-related diseases. Fitness for work evaluation includes the following types of medical examinations. Pre-employment medical examination is usually done to explore basic health profile of a worker before he or she joins a workforce. Pre-placement medical examination is carried out before placing a worker on a job that requires a specific health status to carry out the job. Periodic medical examination is done to monitor the health status of the workers who are exposed to specific workplace hazards on regular basis. It is usually carried out in compliance to statutory requirement or accordance to company's policy. Post-incident medical examination is used to assess health status of the workers following accidental exposure workplace hazards. Workers following injury or illness can undergo medical examination to assess their fitness to return to work, or to plan for work rehabilitation. Pre-retirement is sometimes required by the employer to assess the health status for their workers before retirement. It is meant to ensure welfare of the workers are preserved, and to serve as a baseline health status for future reference. Disability assessment and workers' rehabilitation management are important areas in the practice of occupational medicine. It covers the impairment, disability, and handicap evaluation and management, for the purpose monitoring, compensation, and return to work management. Occupational medicine practice covers various workplace intervention methods. For example, incorporating clinical treatment with work requirement, modification of workstation, work process and tools, relocation of workers, and improvement of work environment. Research skills is important to understand and interpret the research papers, so that one can confidently adopt research findings into practice. It is important for evidence-based occupational medicine practice. Occupational medicine covers national and international legislation related to occupational health. It also includes both clinical medicine and public health ethics. Health promotional domains in the workplace can cover topics not limited to occupational safety and health, but also public health, non-communicable diseases, general hygiene, and healthy lifestyles topics. Occupational medicine is closely related to environmental medicine. Workplace environment or environment surrounding the workplace may have significant impact on workers' health. Hence, occupational medicine practice covers topics such as water pollution, air pollution, solid waste disposal, and wastewater disposal. It is important to have some management skills in occupational medicine, because occupational medicine is not purely a clinical discipline, but rather a discipline that requires a physician to play a role as the facilitator between employer and employee, in the management of work-related health conditions. These include principles and practice of management, policies, strategies, activities planning and implementation, industrial relations and communication skills, auditing skills, and documentation skills. Occupational physicians should have detailed knowledge of potential hazards in the workplace, including toxic properties of materials used. He should be able to diagnose and treat occupational disease and injury, and evaluate employee fitness for work. He should know about rehabilitation methods, health education, and government laws and regulations concerning workplace health, and able to manage health service delivery for the workforce. Occupational history taking is the most important history taking skill in the practice of occupational medicine. Occupational history should be comprehensive, and able to achieve the aim of managing a case. It should be properly documented, and traceable, for future litigation. What is the purpose of taking occupational history? When we take an occupational history, we might keep in our mind two aims. First, to explore the effects of work on health, and second, to explore the effects of health on ability to work. When we explore the effects of work on health, we are basically looking at the diagnosis of occupational disease, exploring the need to protect the health of the worker, and determining the eligibility for compensation. On the other hand, when we explore the effects of health status on the ability to work, we are assessing fitness for work, exploring the need for work rehabilitation, assessing the safety risk that might be imposed by the worker to himself or coworkers, and assessing the productivity potential of the worker. Basic clinical history precedes any occupational history. We should explore the chief complaint and history of presenting complaint, past medical history, family history, social history, drug history, etc., just as any other clinical history taking. Then, when it comes to proper occupational history, you should ask in detail the tasks, duties, or work processes performed by the worker. You can start exploring by asking what time the worker usually starts work and ends work, what does he do first in the morning when he starts his work, ask him to describe how he perform each task and list down accordingly. You should exposure the working hours, the duration of service, and also any health problem that the worker encountered while working at the workplace as compared to while at home. You must also explore in detail the types of hazard the worker is exposed to at the workplace. Don't be surprised that most of the workers know the hazards they are exposed to in their workplace. You should establish the amount and timing of the exposure. You should also explore the availability of control measures, use of personal protective equipment, and the presence of similar diseases among the coworkers. Occupational history should also include asking the patient's past occupational history, hobbies, and whether he has second job or not. It is important as the presence of previous exposure or exposure outside the current workplace might have contributed to the worker's health disorders. It is also useful to determine whether the health disorder is directly related to the current work environment or not. In occupational medicine practice, we can divide investigations into two types, which are, first, the investigations related to the person, and second, the investigations related to the workplace. Personal investigations include usual clinical laboratory or image investigations such as blood tests and X-rays, and personal exposure monitoring such as noise exposure monitoring and so on. Workplace investigations include usual walkthrough surveys and environmental exposure monitoring for specific workplace hazards. The information from obtained both of these investigations are useful in confirming the occupational diseases. Biological monitoring is a clinical investigation that is carried out on a regular interval to monitor the presence of chemical substance in the human body. Usually, we carry out biological monitoring using blood or urine specimen, although other specimens, such as hair, nails, and feces can also be used. We can measure the chemical itself, or the metabolites of the substance of interest. For example, blood lead level and urine hippuric acid level are biological monitoring for lead exposure and toluene exposure respectively. Biological effect monitoring is the monitoring of health effects caused by exposure to hazardous substances in the workplace. For example, we can measure liver function and renal to monitor the effect of chemical substance exposure to our liver and kidneys. On a looser term, biological effect monitoring can be expanded to include monitoring tests that are done to monitor the health effects due to other airborne hazards or physical hazards, such as noise. For example, lung function test can be done to monitor the effect of particulate matter exposure to the lungs. Audiometry is done to monitor the effect of hazardous noise exposure to the hearing thresholds. In terms of management of occupational-related disorders, same principle of treatment applies as for any other non-occupational related disorders. However, in occupational medicine practice, we have to consider the need for medical removal protection, workplace adjustment, relocation, and intervention in addition to any clinical treatment, to ensure the worker's health is preserved and maintained in the work environment. The approach to the management of occupational-related disorders are rather preventive than curative. Work rehabilitation, return to work management, health promotion, compensation, and reporting requirement are part and parcel of occupational medicine case management strategies. Compliance to legal notification is part and parcel of occupational medicine practice. In most countries, an occupational physician is required by national law to notify the relevant authority when he diagnoses an occupational disease. In the context of Malaysia, any occupational disease is notifiable by law under the provision of Occupational Safety and Health, Notification of Accident, Dangerous Occurrence, Occupational Poisoning, and Occupational Disease Regulations 2004. Legal notification is usually carried out via filling of relevant forms and sending to the relevant authority. In Malaysia, notification can be done by filling in the JKKP7 form, which can be downloaded from the Malaysia Department of Occupational Safety and Health website, and sent to them by courier, or via online, by registering and notifying through a JKKP7 system. Other countries would have their own system of notification. In summary, the scope of occupational medicine practice can be viewed from the spectrum of occupational health management as shown in this diagram. A worker in a workplace will expose to workplace hazards, leading to occupational diseases and disability if nothing is done to protect the worker. An industrial hygienist plays his role by identifying, assessing, and controlling the hazards to reduce the worker's exposure to these hazards. Occupational physician, on the other hand, conducts medical surveillance to detect the disease as early as possible, and treat, and manage the worker to prevent him from ending up with disability and death. The part of where the occupational physician manages the worker is covered under occupational medicine practice. Thank you for your attention.